Alrighty, so the next skill that we are going to show you guys is transferring a patient from the bed to the wheelchair. Okay. Now there also are some automatic fails for this skill that you need to make sure that that you hit on. Which one is going to be that you need to make sure that you're locking the wheelchair. Okay, that's a big one, and a lot of people seem to forget that. So just remember, lock the wheelchair. Second is the patient is going to have their shoes to the side of the bed or underneath the bed. So what you need to do is you need to make sure that your patient has non-skid footwear before their feet touch the floor. Okay, so here we go. We're just going to start this one like we always do. We're going to knock in, knock, knock, knock. Good morning, Mrs. Jones. How are we doing today?
Good.
You're fantastic. My name is Michael, and I'm going to be your CNA today. And we're going to get you up and get you into the wheelchair. How's that sound? All right. So first, let me go ahead and close the curtain for patient's privacy. And I'm going to do hand hygiene. Okay. Then going to come over and get my wheelchair. Okay, now most wheelchairs are fairly universal as far as their operation. Okay, you'll either have to push down on the seat or you'll have to open up from the handles. Okay, and now I'm going to open up both foot rests as well. Okay, normally there's either this little hinge right here or there's handles that you're just going to push a little bit and they're just going to swing open. Okay. Now, for the test, it is not necessary to lock the wheelchair while there is no patient in the wheelchair, but I always like to do that as just kind of a precaution just for myself. Again, it is not mandatory for you to do for the test. Okay. Also going to grab my gait belt. Okay. That's going to allow me to safely transfer my patient. And I also have to get her sneakers. So again, this is the automatic fail point here, so you need to make sure that you put your patient's sneakers on before their feet touch the floor. Okay, so we're just going to go ahead and pick up here. So Ms. Jones, we're just going to go ahead and put your shoes on. Okay, there we are. And you're just going to work the shoes on. Okay, that's one. And again, this is a very important safety feature. You have to make sure that your patient has non-skid footwear on before their feet touch the floor. Okay, there we go. Loosen that up just a little bit. If any of you have ever had to put shoes on your children or anything like that, it's pretty much the same idea. So it's good to practice. Okay, all right. So shoes are on. So now what we're going to do is we're going to make a maneuver to where we're actually going to sit our patient up, okay, and they're going to be dangling their legs and feet off of the side of the bed. So you want to make sure that their feet are touching the floor, okay? Now for whoever your patient may be, possibly somebody who's a little shorter, you want to get them a little closer to you so that way their feet do touch the floor, okay? So Mrs. Jones, I'm just going to go ahead and put my hands underneath bending your knees here, okay? And your back, and on the count of 3, we're going to turn. So 1, 2, and 3. There we are. Feet have to touch the floor, so you just want to make sure of that. Okay? Do you feel dizzy? No. Okay. You want to make sure you ask your patient that. Okay. So now I'm going to be bringing the wheelchair close to me here. Okay? And locking it. First, I want to make sure that I put the gait belt on. Okay? And again, for your wheelchair, this is just technically the staging area. It's not just, you want to make sure that you have it nice and close to the bed when you do transfer your patient. Okay, because you don't want them making any steps towards. You just want to pivot and go into the wheelchair. Okay, so you just want to make sure that this is nice and tight here. And it's got to be 2 fingers tight. Okay, you fit 2 fingers. It's nice and Nice and level. Okay, how's that feel for you? All right. All right. And then any extra that you may have, you're just going to go ahead and tuck it underneath. Okay. Any excess. Now go ahead and bring your wheelchair as close as you can to the bed. I normally like to have it to where it's actually touching. Okay. And again, transferring your patient, should be no steps. So it should just be a nice pivot and then a nice soft landing into the wheelchair. Okay? So Mrs. Jones, we're just going to go ahead and put one foot here in between yours. There we go. Okay? I'm going to go ahead and pick up here. You're going to put your hands on my shoulders. And on the count of 3, we're just pivoting to the chair. So 1, 2, and 3. Okay? And then a nice, easy landing. Okay? So I'm going to unlock the wheelchair, push it out just a little bit, and then lock it again. The main reason why I do that is because you want to make sure that you can move the foot pads, because a lot of times if you're underneath the bed, they won't move. Okay? And then your patient's foot, you have to place your patient's foot up on the foot pedals. Okay? So now your patient is locked and is ready to be pulled back so that they can reseat themselves in the wheelchair. Okay? So Ms. Joseph, I'm just going to have you lean forward a little bit for me. You're going to get underneath the gait belt, and on the count of 3, push with your feet. 1, 2, and 3. That helps reseat the patient, okay, into the wheelchair a little better. How are we feeling so far, okay? Yep. Excellent. You're now going to make sure you take the gait belt off, so up and over. You just put your arms up for me. Thank you. Okay, you're going to put your gait belt away. And then you're going to unlock your patient. Okay, and you're just going to put them to the side of the bed. Lock the wheelchair, very important. Ms. Jones, can I get you a magazine or anything?
No, that's okay.
Excellent. There's your call light. You call me if you need anything. I'm going to open the curtain, perform hand hygiene, and look at the evaluator. This skill is now done.